There's a common misconception that neutering solves all prostate problems, and it doesn't. And so we have two dogs in the clinic today. One of them intact here, as you can see, his nose is constantly going, and one of them that's not, who was neutered as a puppy. And I'm gonna show you the ultrasounds on both of their prostates to show you that indeed the prostate can be affected whether a dog is intact or whether it's neutered. Neutering certainly is going to solve testicular issues and prevent testicular cancer, but the prostate's a little bit trickier. And so the reason for this video is that oftentimes hear veterinarians say that if we neuter your dog, it won't have prostate problems or testicular problems, and only half of that equation is true. We can still see prostate issues, whether it's infection, abscesses, or cancer in neutered dogs as well. And so we're gonna take a look at both of these ultrasounds. So this is the ultrasound image of the prostate of the neutered dog, and he was neutered at a couple of months of age, and he's currently 9 to 10. So he's been neutered for nearly a decade. When we take a look at the images here, on the left side of the screen, this black area is the bladder, and then this is tube coming out of the bladder is the urethra, and where that goes through next is the area of the prostate right here. And so in a dog that's been neutered for 10 years and was neutered as a puppy, the normal would be almost for not to be able to even see this prostate. Unfortunately, these little white spots within that, the spiculation, is likely mineralization, which is usually an indication of prostate cancer. And so our next step is going to be to stick a needle in the prostate to get a sample for a pathologist to look at. But likely we're dealing with prostate cancer in this neutered dog. So as you could see in this dog who was neutered as a puppy, neutering was not protective for prostate cancer. And so that's the point to remember here, is that while neutering will eliminate the potential for testicular cancer, it is not necessarily protective for the prostate. So this is the prostate on the intact dog. And so for orientation, up this way is the bladder, and you can see going into the urethra, and then back over here is the area of the prostate, in quite a bit different appearance. So this is all kind of uniform, where we have this increased area here, and then down here we have cystic changes. And so likely not cancer in this case, more probably related to benign prostatic hyperplasia. So again, because of him being intact, this area could also be a pocket of infection related to that. So two very distinct processes going on with these prostates on an intact and a neutered dog. Our diagnostic samples on both dogs confirmed our suspicions that we had based on exam and then obviously the ultrasound findings. So the intact dog came back as benign prostatic hyperplasia. So they didn't see any evidence of abnormal cells on the samples that were sent off. And the fluid was also sent off because sometimes these dogs with BPH, the benign prostatic hyperplasia, will have a prostatitis as well. And so we did culture the fluid that we obtained, and that also did not show any evidence of infection. And so that dog has kind of two paths to take to help with resolving the symptoms and then the hyperplasia as well. So neutering will definitely help. Oftentimes this is testosterone related. And so if we remove the testosterone, we can remove the problems. The other option is a medication. So just like with some humans, we have to have BPH medications. The same medication can be used in dogs as well. And so I have a number of dogs in the practice who are prized breeding dogs, dogs that maybe we want to collect a few more times to freeze, or that we have some planned breedings coming up. And there are medications that we can use to help control some of the symptoms that are being seen in those dogs. And so I've had a couple of dogs that were actually on the medications for years without any issues with the medications, and it really resolved some of the symptoms that owners were dealing with related to the benign prostatic hyperplasia. With the neutered dog, unfortunately, the samples that we obtained from that dog did also confirm that it had cancer of the prostate. And so with those dogs, so a neutered dog with mineralization, when we look at the studies, it's almost a 100% predictive value that mineralization in a neutered male's prostate is going to be cancerous. And so the findings that we had there, coupled with the samples that we took, did confirm for that dog. And so there are some options, albeit limited, with prostatic neoplasia. And so that owner elected to not pursue any of the potential treatment options based on the particular tumor type that we suspected in that dog. So there are some chemotherapy agents, but they elected not to pursue those, and instead are just going to focus on keeping the dog comfortable until the symptoms become such that they're going to have to make a decision. And so why did I choose to do this video specifically to prostates? When these two dogs came into the clinic, it triggered in my mind that we probably need to dive into this, because there's a lot of misconceptions out there about which path is best. best. And so I didn't do this one to muddy the water. It's just to point out that even some veterinarians still are confused as it relates to the benefits and the cons to spaying and neutering. And so you hear a lot of veterinary staff members proclaim that neutering a male dog will solve for testicular cancer and prostate cancer. And that's just not the case as you saw in this video. And so it helps with one half of that equation, and that's the testicular cancer. Obviously, a dog without testicles is not going to have testicular cancer. But when we look at the studies, neutered male dogs actually get prostate cancer more than intact dogs. And so there's a lot of these factors that we have to take into account. And sometimes we use misinformation, not on purpose, but incorrectly. We make assumptions. And as we get to uncover more of the information out there, we learn more of the facts. And so this is going to be the first video in a series of videos where we look at that research that exists on the benefits of neutering and spaying your pet and the risks involved with that. So the benefits of keeping them intact. And it's not a black and white issue. And so here we see that you would use the argument that neutering a dog is going to potentially cause cancer. As I'm filming this here in my office, I have 2 dogs laying on the couches here in my office, and both of them are either neutered or spayed. And so both were done later in life. So I made a calculated decision as to how long I kept them intact and then when I removed the sex organs. But there's a lot of factors that go into that. And so we're going to tackle that over the next couple of weeks and look at the evidence that exists, which of the evidence doesn't exist that people think is out there, and then help you to decide the best path for your dog. And so I'm not going to say what answer is best. I think that it's a decision that needs to be made by an individual owner about an individual pet with the help of their veterinarian.